What if daily masturbation could reveal surprising truths about your prostate health? For older men, PSA levels are a key indicator of prostate function, but they can sometimes behave in unexpected ways. Could your daily habits be influencing these levels? The answer might shock you. Research shows that frequent ejaculation can temporarily spike PSA levels, but it might also have long-term benefits for prostate health. So what's the real story? Is masturbation a friend or foe to your prostate? Let's uncover the facts and explore how understanding this connection can empower you to take control of your health. PSA, or prostate-specific antigen, is a protein produced by the prostate gland, and it plays a key role in men's health. Think of it as a tiny messenger in the body, giving clues about how the prostate is functioning. For older men, keeping an eye on PSA levels can be like having an early warning system for potential issues. It's not just about cancer. PSA levels can also hint at conditions like prostatitis or an enlarged prostate. So, understanding PSA isn't just for doctors. It's something every man should know about as he ages. Now you might wonder, why does this matter to me? Well, imagine your prostate as a car engine. PSA is like the oil light on your dashboard. It doesn't always mean something's broken, but it's a sign to check under the hood. High PSA levels can indicate inflammation, infection, or even the early stages of prostate cancer. On the flip side, low levels are generally a good sign, but they don't guarantee everything's perfect. The key is to monitor these levels regularly, especially as you get older. Let's get practical for a moment. Say you're a man in your 60s and you've noticed some changes in your urinary habits. Maybe it's harder to start or stop peeing, or you're going more frequently at night. These could be subtle signs that your prostate isn't functioning as smoothly as it used to. A PSA test, which is a simple blood draw, can help your doctor figure out what's going on. It's not something to fear. It's a tool to empower you with knowledge. But here's where it gets interesting. PSA levels can fluctuate for reasons that might surprise you. Things like recent ejaculation, certain medications, or even a vigorous bike ride can temporarily raise your PSA. That's why it's important to talk to your doctor about the right time to test and how to interpret the results. So, while PSA is a powerful indicator, it's not the whole story. And that leads us to the next big question. How exactly are PSA levels measured, and what do those numbers really mean? PSA levels are measured through a simple blood test, often done as part of a routine checkup for older men. The process is quick and straightforward. Just a small sample of blood is taken, usually from the arm, and sent off to a lab for analysis. The results are typically reported in nanograms of PSA per milliliter of blood. And while the numbers might seem like just another statistic, they can tell a lot about what's happening with the prostate. For most men, a PSA level under 4 nanograms per milliliter is considered normal, but this isn't a hard and fast rule. What's fascinating is that PSA levels can vary from person to person, and even from day to day. For example, a man in his 70s might have a slightly higher baseline PSA level simply due to age, and that's not necessarily a cause for alarm. On the other hand, a sudden spike in PSA could be a red flag, prompting further investigation. It's like checking the weather. You don't just look at the temperature. You consider the trends and patterns over time. Let's say a man gets his PSA tested and the result comes back at 5 nanograms per milliliter. Is that high? Well, it depends. If his previous test showed levels around 2 nanograms per milliliter, that jump could signal something worth looking into. But if his levels have always hovered around 5, it might just be his normal. This is why doctors often recommend regular testing. It's not just about the number itself, but how it changes over time. Tracking these trends can provide a clearer picture of prostate health. Of course, PSA levels aren't the only factor to consider. Symptoms like difficulty urinating, frequent nighttime trips to the bathroom, or discomfort in the pelvic area can also provide important clues. Combining these observations with PSA test results helps doctors make more informed decisions. But here's a question that often comes up. Can something as simple as daily masturbation affect these levels? That's where things get even more intriguing, and it's exactly what we'll explore next. Daily masturbation is a topic that often makes men raise an eyebrow, especially when it comes to prostate health. But here's the thing, research suggests that regular ejaculation can have a temporary impact on PSA levels. When a man ejaculates, whether through masturbation or sex, it can cause a short-term increase in PSA production. This happens because the prostate is actively involved in the process, and the physical activity can stir things up a bit. It's like going for a jog. Your heart rate goes up temporarily, but it settles back down afterward. For example, a study found that men who ejaculated within 24 hours of a PSA test had slightly higher levels compared to those who hadn't. This doesn't mean masturbation is harmful, it just means timing matters. If you're scheduling a PSA test, it might be a good idea to avoid ejaculation for a day or two beforehand to get a more accurate reading. Think of it as giving your prostate a little breather before the checkup. Now, some men worry that frequent masturbation could lead to long-term changes in PSA levels or even increase the risk of prostate issues. But here's the good news. There's no strong evidence to support that idea. In fact, some studies suggest that regular ejaculation might even be beneficial for prostate health by helping to clear out old fluids and reduce the risk of inflammation. It's like keeping the pipes clean. Everything flows better when there's regular movement. So what's the takeaway? Daily masturbation isn't something to stress over when it comes to PSA levels. It might cause a temporary bump, but it's unlikely to have a lasting impact. The key is to be mindful of timing if you're getting tested and to focus on overall prostate health through regular checkups and a healthy lifestyle. But this raises another question. Could daily ejaculation have any long-term effects on PSA levels or prostate health? That's a topic worth digging into next. Did you know that by liking the video and subscribing to the channel, YouTube starts recommending more content related to the same video? That's right, do it and stay up to date with your sexual health. Now let's continue. When it comes to daily ejaculation and its long-term effects on PSA levels, the waters get a little murkier. While short-term spikes in PSA after ejaculation are well documented, the long-term impact is less clear. Some men wonder if frequent masturbation could lead to chronically elevated PSA levels or even increase the risk of prostate problems down the line. The truth is, research hasn't found a strong link between regular ejaculation and long-term changes in PSA. In fact, some studies suggest that frequent ejaculation might even be protective for the prostate. Take, for example, a large study that followed men over several decades. It found that those who ejaculated more frequently, whether through masturbation or sex, had a slightly lower risk of developing prostate cancer. While the reasons aren't entirely clear, one theory is that regular ejaculation helps flush out potential toxins and reduces inflammation in the prostate. It's like giving your car a regular oil change. It keeps everything running smoothly and prevents buildup over time. That said, it's important to remember that PSA levels are influenced by many factors, not just ejaculation. Age, genetics, diet, and overall health all play a role in determining PSA levels and prostate health. So, while daily masturbation might not be a major concern, it's still crucial to keep an eye on the bigger picture. Regular checkups, a balanced diet, and staying active are all part of maintaining a healthy prostate as you age. But here's where it gets interesting. Even though frequent ejaculation might not raise PSA levels long-term, it's still possible for other habits or conditions to do so. For instance, an untreated infection or an enlarged prostate could cause PSA levels to creep up over time. That's why it's so important to monitor your levels and work with your doctor to understand what's normal for you. And speaking of monitoring, let's not forget the elephant in the room: how PSA levels are tied to prostate cancer risk. That's a topic we'll explore next. Elevated PSA levels can be a red flag for prostate cancer, but it's not always as straightforward as it seems. Think of PSA as a smoke detector. It can alert you to potential danger, but it doesn't always mean there's a fire. For older men, a rising PSA level might prompt further tests, like a biopsy, to rule out cancer. However, it's important to remember that high PSA levels can also be caused by non-cancerous conditions, such as an enlarged prostate or prostatitis. So, while PSA is a useful tool, it's not the only piece of the puzzle. For example, let's say a man in his late 60s gets his PSA tested and the result comes back at 6 nanograms per milliliter. His doctor might recommend additional tests to determine the cause. If those tests reveal an infection or inflammation, treatment could bring his PSA levels back down. On the other hand, if cancer is detected, catching it early can make a huge difference in treatment options and outcomes. That's why regular PSA testing is so important. It's about staying one step ahead. But here's the tricky part. Not all prostate cancers are aggressive. Some grow so slowly that they may never cause serious harm, especially in older men. This is where the concept of active surveillance comes into play. Instead of rushing into treatment, doctors might monitor the cancer closely, only intervening if it shows signs of progression. It's a balancing act, weighing the risks and benefits of treatment while keeping a close eye on PSA levels and other indicators. Of course, the thought of prostate cancer can be daunting, but knowledge is power. Understanding the link between PSA levels and cancer risk empowers men to make informed decisions about their health. And while PSA is a key player, it's not the only factor to consider. Lifestyle choices, family history, and overall health all play a role in prostate cancer risk. So, what can men do to keep their PSA levels in check and reduce their risk? That's exactly what we'll explore in the next topic. Keeping an eye on PSA levels and maintaining prostate health doesn't have to be complicated. In fact, a few simple habits can go a long way. First and foremost, regular checkups are essential. For men over 50, or earlier if there's a family history of prostate issues, scheduling annual PSA tests can help catch potential problems before they escalate. Think of it like changing the oil in your car. It's a small effort that can prevent bigger issues down the road. And don't forget to discuss any symptoms like urinary changes or discomfort with your doctor. They're important clues too. Diet also plays a significant role in prostate health. Foods rich in antioxidants like tomatoes, thanks to lycopene, green leafy vegetables and berries, can help reduce inflammation and support overall prostate function. On the flip side, cutting back on red meat, processed foods, and excessive alcohol can lower the risk of prostate issues. It's not about perfection, it's about making small, sustainable changes. For example, swapping out a burger for grilled salmon once a week can be a tasty and healthy choice. Exercise is another powerful tool for keeping PSA levels in check. Regular physical activity, whether it's walking, swimming, or even gardening, can improve circulation, reduce inflammation, and support a healthy weight, all of which are good for the prostate. Plus, staying active can boost mood and energy levels, making it easier to stick to other healthy habits. Even something as simple as taking the stairs instead of the elevator can add up over time. Hydration is often overlooked, but is crucial for prostate health. Drinking plenty of water helps flush out toxins and keeps the urinary system functioning smoothly. However, it's best to avoid drinking large amounts right before bed to minimize nighttime trips to the bathroom. And for men who enjoy caffeine, cutting back in the evening can also help improve sleep quality, which is important for overall health. Finally, stress management is key. Chronic stress can take a toll on the body, including the prostate, so finding ways to relax is essential. Whether it's through meditation, hobbies, or spending time with loved ones, reducing stress can have a positive impact on both mental and physical health. But here's the kicker. Despite all these tips, there's still a lot of confusion and misinformation out there about PSA levels and prostate health. That's why it's time to tackle some common myths and set the record straight. When it comes to PSA levels and masturbation, there's no shortage of myths floating around. One common misconception is that frequent masturbation can permanently raise PSA levels and increase the risk of prostate cancer. The truth: while ejaculation can cause a temporary spike in PSA, there's no evidence that it leads to long-term changes or higher cancer risk. In fact, some studies suggest that regular ejaculation might even be beneficial for prostate health by reducing inflammation and flushing out old fluids. It's like clearing out the pipes. Everything works better when there's regular flow. Another myth is that PSA tests are only necessary if you're experiencing symptoms. The reality is that prostate issues, including cancer, can develop without obvious signs in the early stages. That's why regular PSA testing is so important, especially for older men or those with a family history of prostate problems. Think of it as a routine maintenance check. It's better to catch potential issues early than to wait for a breakdown. Then there's the belief that only high PSA levels are a cause for concern. While elevated levels can be a red flag, it's not just about the number itself. Factors like age, recent ejaculation, or even a urinary tract infection can temporarily raise PSA. That's why doctors look at trends over time rather than a single result. For example, a gradual increase in PSA over several tests might be more concerning than a one-time high reading. Some men also worry that lifestyle changes won't make a difference in their PSA levels or prostate health. But the truth is, small changes can have a big impact. Eating a balanced diet, staying active, and managing stress can all contribute to a healthier prostate. It's not about overhauling your life overnight. It's about making consistent, positive choices that add up over time. Finally, there's the myth that prostate health is something men don't need to think about until they're older. The reality is that taking care of your prostate is a lifelong commitment. Whether you're in your 40s or your 70s, being proactive about your health can make all the difference. So, don't wait for symptoms to appear. Start taking steps today to support your prostate and overall well-being. So, what's the takeaway from all this? PSA levels and prostate health are more connected to your daily habits than you might think. Whether it's through regular checkups, a balanced diet, or even understanding the effects of masturbation, taking small steps can make a big difference. Are you ready to take control of your prostate health and make informed choices? Remember, knowledge is power. By staying proactive and informed, you can navigate the complexities of aging with confidence. So, what's your next move? Will you schedule that PSA test, tweak your diet, or simply stay curious about your health? The choice is yours. Don't forget to like this video, subscribe to the channel, and hit the notification bell to stay updated on all things prostate health. Also, watch this video that's appearing on the screen. It's just as important. Click on it and keep learning.